Good evening, my name is Michelle Alvarado. My topic, Tenofovir to prevent hepatitis B transmission in mothers with high viral load. Definition: Hepatitis B virus HBV, a leading cause of cirrhosis and liver cancer, is a serious health threat, and prevention of HBV transmission is an important part of the strategy to alleviate infection and its outcomes. Hepatitis B virus can be vertical transmitted from mother to fetus during childbirth, and infants who are untreated can consequently develop chronic infection. Next video.
Hepatitis B and C are viral infections which affect the liver of a human being, and when this happens during pregnancy, it can lead to many complications for the mother in terms of the pregnancy complications as well as on long-term effect of these viruses on the body. So these infections usually present as a loss of appetite, vomiting, jaundice, and decrease in urination, abdominal distension. And these infections, when they happen acutely in pregnancy, can cause a lot of trouble to the baby as well. So vaccine for hepatitis B is currently available, but hepatitis C does not have a vaccine yet. Other than the health risk to the mother, the baby is also at risk of getting this viral infection from the mother through the placenta. So when the baby is born, the baby is given hepatitis B vaccine and immunoglobulin for its protection, whereas hepatitis C has to be managed symptomatically.
The birthplace. Why deliver anywhere else?
Application in nursing. Takes vital signs. Use security measures. Administer the hepatitis B vaccine in the newborn. Perform respective laboratory tests to the newborn. Administer tenofovir to the mother. Video.
This video is about hepatitis B vaccine. We'll talk about the schedule, infants born to the hepatitis B positive moms, and post-immunization testing of these infants. The schedule is a 3-dose vaccine series. Usually we give it 0 to 6 months of age. The first and second dose is separated by 4 weeks minimum. Minimum duration between the second and third dose at minimum is 8 weeks. The minimum duration between the first and last dose is 16 weeks. The last dose minimum age to be given is 6 months old or 24 weeks of age. Now let's talk about the infants born to hepatitis B positive mothers. If a mother is a hepatitis B surface antigen positive, it's very important to give the baby hepatitis B vaccine, hepatitis B immunoglobulin, both within 12 hours. If the baby is under 2 kilograms, then if the baby's preterm, we know that there's decreased seroconversion of hepatitis B vaccine. So that baby will still need 3-dose series. So it's as if you haven't given that baby the hepatitis B vaccine at all. So if the mom is hepatitis B surface antigen positive, regardless if they're under 2 kilograms or above 2 kilograms, we still have to give both immunoglobulin and the hepatitis B within 12 hours. But the infant under 2 kilograms will need 3 more doses, and the infant over 2 kilograms only need 2 more doses. The first dose for this infant here can be given at 1 month or at hospital discharge, and the rest can be given as the regular series. Also, let's talk about post-immunization testing. So babies that are born to hepatitis B positive moms, at 9 to 18 months, it's recommended you check for hepatitis surface antigen and anti-hepatitis B. So you're looking for the infection and you're looking for a response. Babies that are not infected, that means they're hepatitis B surface antigen negative, and they also have not responded, will still need the 3-dose series.
Pros and cons. Advantage. The strategy of antiviral treatment administered during third trimester not only offer the advent of reducing the risk for HBV transmission at the time of delivery, but also avoid any possible teratogenic effect of antiviral therapy during the critical first trimester of fetal development. Disadvantage. Few studies were random double-blind controlled clinical trials. Thus the evidence-based data on which to base strong recommendations for antepartum antiviral therapy are limited. Moreover, the cost of antiviral therapy may be prohibitive in developed countries where HBV is endemic. Issue apply in Ecuador. According to Ministry of Health indicator, the total prevalence rate of hepatitis B in Ecuador is 32.6%, which is high that report by the World Health Forum. The percent of hepatitis due to endemicity are also high in pregnant women, infants, and indigenous population in the Amazon region. Conclusion. In my opinion, Tenofovir is the effective retroviral to prevent prenatal transmission back in Ecuador. Health center usually runs. Quickly there is very little information in the community about the use of this retroviral. Bibliography. Thank you.